I'm Dr. Sara, and today I'll explain what your body is quietly signaling when it wakes you up at 3 a.m. Waking up at 3 a.m. to urinate is often one of the earliest and most overlooked signals that the prostate may be under strain, especially in men over 40. The prostate is a small gland, but it plays a powerful role in urinary control. And when it begins to enlarge, even slightly, it presses against the urethra, narrowing the passage through which urine flows. During the day, gravity and movement help the bladder empty more effectively. But at night, when the body is lying flat and the nervous system shifts into rest mode, this restriction becomes more noticeable. The bladder may not fully empty before sleep, causing the brain to send a wake-up signal hours later. This is why many men find themselves waking at almost the same time each night, often around 3 a.m., feeling a sudden and urgent need to urinate even if the volume is small. This is not simply a normal part of aging, but a physiological change that reflects how the prostate responds to hormones, inflammation, and lifestyle factors over time. Testosterone gradually converts into dihydrotestosterone, DHT, as men age, and DHT directly influences prostate growth. When this process accelerates, the prostate becomes more sensitive, more swollen, and less flexible, leading to nighttime urinary disruption. Inflammation from poor diet, excess sugar, processed foods, lack of movement, and chronic stress can further irritate prostate tissue, amplifying the problem. What makes this signal important is that it often appears long before pain, serious urinary blockage, or medical diagnosis. The body is essentially offering an early warning, giving men a chance to respond with proactive changes rather than reactive treatment. Ignoring this sign can allow the cycle to continue, gradually worsening sleep quality, reducing testosterone production, increasing fatigue, and weakening overall male vitality. Sleep interruption itself compounds the issue, because deep sleep is when hormonal repair occurs, including testosterone regulation and tissue recovery. When the prostate disrupts sleep, it indirectly affects energy, mood, muscle strength, and sexual health. Many men dismiss the symptom, assuming it's harmless or inevitable, but the consistency of waking at the same early morning hour points to a biological pattern rather than coincidence. Addressing prostate health early through better nutrition, reduced inflammation, regular physical activity, stress control, and medical awareness can significantly reduce nighttime urination and restore natural sleep rhythms. The body communicates subtly before it shouts, and the 3 a.m. bathroom trip is one of the clearest examples of the prostate quietly asking for attention through disruption rather than pain. Waking up at 3 a.m. to urinate can be a quiet but powerful signal that blood sugar levels are not being regulated properly, even in men who have never been diagnosed with diabetes. During the night, the body is meant to rest, repair, and stabilize hormones, but when blood glucose remains elevated, the kidneys are forced into overdrive. Their role is to filter excess sugar from the bloodstream, and when glucose levels rise beyond what the body can efficiently use, water is pulled along with it through the urine in a process known as osmotic diuresis. This leads to increased urine production, precisely when the body should be conserving fluids. The bladder fills more quickly, triggering a wake-up signal to prevent discomfort or leakage. What makes this especially deceptive is that the urge to urinate may be strong even when fluid intake was minimal before bed, causing confusion and dismissal of the symptom. Late-night meals high in refined carbohydrates, sugary snacks, sweetened beverages, or even heavy portions of starchy foods can spike blood sugar hours after eating, pushing the body into a state of metabolic stress during sleep. Over time, repeated nighttime urination becomes a pattern, often occurring around the same early morning hour when insulin sensitivity naturally drops and cortisol begins to rise. This hormonal shift makes it harder for cells to absorb glucose, leaving more sugar circulating in the blood and forcing the kidneys to compensate. Insulin resistance, which often develops silently for years, worsens his process by preventing glucose from entering muscle and liver cells efficiently. As a result, the body relies increasingly on the kidneys to manage the overload. The impact goes beyond disrupted sleep. Repeated awakenings interfere with deep sleep cycles that are essential for testosterone production, fat metabolism, and nervous system recovery. Poor sleep then further increases insulin resistance, creating a vicious loop where blood sugar imbalance and nighttime urination reinforce each other. Many men notice fatigue, increased thirst, brain fog, and weight gain without realizing these symptoms are metabolically connected. The body is essentially signaling that its energy management system is under strain and needs recalibration. Addressing this signal early through dietary awareness, reduced sugar intake, balanced evening meals, improved physical activity, and consistent sleep patterns can help stabilize blood glucose and reduce nighttime urination. The timing of the symptom is not random, it reflects how the body handles sugar under low activity and hormonal transition, making the 3 a.m. wake up a metabolic message rather than a bladder problem alone. Waking up at 3 a.m. to urinate can be closely tied to hormonal imbalance, particularly involving testosterone and antidiuretic hormone, both of which play critical roles in male health and nighttime bladder control. In a well-regulated body, antidiuretic hormone increases at night, signaling the kidneys to reduce urine production. So sleep can remain uninterrupted. When this hormone is disrupted, the kidneys continue producing urine at daytime levels, filling the bladder faster and forcing the body to wake up. One of the most common reasons for this disruption is poor sleep quality itself, which alters the natural circadian rhythm that governs hormone release. Stress, irregular sleep schedules, late-night screen exposure, and chronic fatigue interfere with the brain's ability to regulate these hormones properly. Testosterone, which is primarily produced during deep sleep, is also deeply connected to this process. As testosterone levels decline, bladder and pelvic muscle tone weaken, reducing the ability to hold urine for extended periods at night. Lower testosterone also affects nerve signaling between the bladder and brain, increasing sensitivity and urgency even when the bladder is not completely full. This creates a false alarm system that disrupts sleep repeatedly. Hormonal imbalance does not occur in isolation. Elevated cortisol, the stress hormone, often peaks around early morning hours and can further suppress testosterone while stimulating urine production. When cortisol remains high due to chronic stress or poor recovery, it throws the entire hormonal network out of balance, making nighttime awakenings more frequent and more predictable. Aging amplifies this effect, but lifestyle factors accelerate it far more than age alone. Alcohol consumption, poor diet, excess body fat, and lack of physical activity all interfere with hormone regulation, increasing estrogen dominance in men and worsening fluid retention and nighttime urination. The brain and bladder operate as a coordinated system, and when hormonal signals become inconsistent, the bladder loses its nighttime quiet mode. Repeated sleep disruption then feeds back into the problem because fragmented sleep reduces testosterone production even further, weakens insulin sensitivity, and increases inflammation. This creates a downward spiral where hormonal imbalance and nocturnal urination reinforce each other. Many men assume waking at 3 a.m. is just part of getting older, but the precision of the timing reflects a circadian misalignment rather than inevitability. The body is signaling that its hormonal rhythm is no longer synchronized, and this message appears during the quietest hours of the night when repair should be happening. Waking up at 3 a.m. to urinate can be strongly influenced by how and when the body is hydrated rather than simply how much water is consumed. Many men unknowingly create a pattern of dehydration during the day, followed by overhydration in the evening, forcing the kidneys to compensate at night when they should be resting. When the body does not receive adequate fluids earlier in the day, it activates conservation mechanisms that alter kidney function and hormone release. Once water is finally consumed in larger amounts after dinner or close to bedtime, the kidneys respond aggressively, producing urine well into the night. This delayed processing often peaks during the early morning hours, leading to sudden awakenings with a strong urge to urinate. On the opposite end, excessive fluid intake late at night, even with healthy intentions, overwhelms the bladder's capacity during sleep. The body cannot simply shut down kidney filtration, and gravity no longer assists fluid distribution when lying flat, causing fluid that pooled in the legs during the day to return to circulation. This redistributed fluid is filtered by the kidneys overnight, increasing urine production. Electrolyte balance also plays a critical role in this process. Drinking large amounts of plain water without adequate sodium, potassium, or magnesium can dilute blood electrolytes, signaling the kidneys to excrete excess fluid to restore balance. This can make nighttime urination more frequent, even when overall hydration seems adequate. Caffeine and alcohol further complicate hydration timing by acting as diuretics, increasing urine output hours after consumption, and disrupting antidiuretic hormone release. Even small amounts consumed in the afternoon or evening can have delayed effects during sleep. The bladder itself is affected by inconsistent hydration habits. When urine becomes overly concentrated due to daytime dehydration, the bladder lining becomes irritated and more sensitive, increasing urgency at night even with smaller urine volumes. Over time, this sensitivity trains the brain to respond to bladder signals more aggressively, shortening the window of uninterrupted sleep. Kidney function follows a natural circadian rhythm, designed to reduce urine production at night, but erratic hydration patterns override this rhythm and keep the kidneys active. Many men mistake this issue for prostate or aging problems, when in reality the body is reacting to timing errors in fluid intake. The precision of waking around 3 a.m. reflects the delayed metabolic processing of fluids and electrolytes rather than random chance. When hydration is uneven, the body uses the quiet hours of sleep to rebalance itself, and the bladder becomes the messenger that interrupts rest to restore internal stability.